The criteria for an AP knee is there needs to be no rotation, the femoral condyles need to be symmetric, the intercondylar eminence needs to be centered, the fibula needs to have slight superimposition over the tibia. The patella needs to be completely superimposed over the femur. There needs to be open joint space between the patella or the femur and the tibia. And then there also needs to be equal distance of width on either side. The lateral knee projection criteria is the knee needs to be flexed 20 to 30 degrees and the femoral condyles need to be superimposed. The fibular head and the tibia should have slight superimposition. The patella needs to be in the lateral profile. There needs to be open patellofemoral joint space, and there needs to be open joint space between the femoral condyles and the tibia. For the AP medial oblique rotation of the knee, the tibia and the fibula need to have separation at the proximal articulation. You need to be able to see the posterior tibia, as well as the lateral condyles of the femur and the tibia. You need to see both tibial plateaus, and the margin of the patella is projecting slightly over the medial side of the femoral condyle, and you also need to have open joint space of the knee. Clare method or tunnel view, the apiaxial projection of the knee. You need to have an open intercondylar fossa and open knee joint space. There needs to be no superimposition of the fossa by the patella, which it's not. And there needs to be no rotation, which is demonstrated by the fibula superimposition over the tibia. And the posterior inferior surface of the femoral condyles need to be seen too. For the tangential projection or the Setagas method, you need to be able to see the patella in profile, and you need to be able to see the femoral condyles and the intercondylar sulcus, and you also need to have open patellofemoral articulation.